We have Dr. Joshua Burnham here with us this morning. Welcome.
Thanks. It's
We're
good
glad
to be
to
here.
have you.
I'm thankful I'm here.
Good. Well, I thought first of all you could tell us a little bit about yourself, and then let's talk about what you're doing here and
Sure.
all that stuff.
Yeah, so I'm first and foremost a husband. My
Okay.
wife and I have been married for 6 years, and we also have 3 children together, and a 4th is on the way here within a month.
Ooh, okay.
So a lot of change.
Congratulations.
Thank you. A lot of change happening very
Right.
quickly. And then I've been in practice here in Owatonna for going on a year. So
Okay.
in February, actually this month, it just turned February, so I'll be
So your
celebrating my
1-year
1 year
anniversary.
Yeah,
Well,
yeah.
welcome and
On the
happy
16th.
anniversary.
Thank you. Yeah. So one of my patients advised me to have this discussion and just kind of share a little bit more about myself. So
Good. That's terrific. Well, so a year now, did you open your practice? It was,
Yeah,
you
so
didn't join a practice.
Yep.
This
so
is
when
your practice.
So when I started my office, it was a vanilla shell. So it was just
Okay.
concrete floors with white
Sure.
walls.
Right.
And then we built it all out to what I needed it to be. And I'm in the space right by East Wind Buffet on the northwest side of town.
Okay,
It used to
yep.
be, I believe it used to be like a massage spa parlor.
Okay.
But obviously now it's a chiropractic
Right.
office.
That's good. That's a good location too.
Yeah, absolutely.
Well, tell us a bit about your practice and your approach to things. And I know probably you've got your own different approach.
Yeah, so let me back up first real quick, and I'll just give you my background, my pedigree.
Sure,
and
that's
then
great.
that'll lead, because it kind of is part of that. So I grew up in New York,
Okay.
and I went to the State University of New York in Cortland, studying exercise science.
Okay.
So I wanted to initially rehab people who were stroke victims, heart attack victims with exercise. It's phenomenal for those people. Graduated top of my class, summa cum laude with exercise science and chemistry. But what got me into chiropractic was I had some hip pain. I was training in martial arts at the time, and I couldn't walk very well, and my training was starting to suffer. And got into the chiropractic office. I remember my brother saying something about it helping him when he had a knee injury. And so I went in there, and with the first adjustment, I just knew that that's what I needed to do.
Right.
And after that, I just focused all my energy on getting to chiropractic school.
Okay.
Graduated when I was 20, moved down to
Wow.
South Carolina, and started chiropractic school at Sherman College Chiropractic in South Carolina. Went there for 2 years, decided it wasn't the right fit for me, left school, and then in 2017 I started school at Northwestern Health Sciences University in Bloomington. Mm-hmm. And during that course of time I got familiar with my technique, which is called Gonstead.
Okay.
And
You'll have to tell us more about that in a minute.
Yeah. So I was the leader of the Gonstead Club on campus for 2 years, and that's how I met Joe Sweary.
Okay.
And Dr. Joe Sweary was a chiropractor here in Owatonna for about 20 years. And he worked closely with Viricon. And so he kind of played a role in my decision to come here. It was partly a mixture of his background as well as the fact that there's no Gonstead provider really anywhere close to Owatonna.
Okay.
That kind of played into my decision making. Now regarding Gonstead, it's kind of for a lot of your viewership, it's probably a meaningless term. But
Right.
let me unpack it a little
Okay.
bit and explain it. So Gonstead is what I would consider to be the epitome of your classic chiropractic. And by classic chiropractic, I mean bone out of place, putting pressure on a nerve, causing the symptoms that you're experiencing, and we have to put the bone back into its proper place. So it started in 1923 with a guy named Clarence Gonstead, and the technique was so effective that he had to build the largest clinic at the time, 22,000 square feet, with a hotel and a private airfield
Wow.
for his patients to fly in from all 6 continents.
Wow.
And now it's a historic site in Mount Horeb, Wisconsin. And in the basement of that clinic, I've been there many times, in the basement of the clinic, they still have pins of where all of his patients came from around the world.
On a map.
And it's,
that's
it's
so
incredible
cool.
to think that all the
Yeah.
way back in like the 40s and 50s and 60s, people were
Wow. Yeah.
coming from all over the place. And so I kind of stand on the shoulders of giants. I learned Gonstead. it really resonated with me because that's why my office's name is Precision Chiropractic Services, because I believe in a precise approach. And what Gonstead is it's a technique that incorporates multiple different diagnostic tests and clinical work to arrive at exactly what areas of the body need to be adjusted and need to be worked on, and leaving everything else alone. And the way that we do that is we use observation, which is just observing the spine, seeing where there's areas that could be inflamed, deformities that you can see. And then we get hands-on, so we do what's called palpation, which is just feeling the spine for areas of pain, tenderness, swelling. And then we feel where there's restrictions and fixations in the spine, which can tell us where there's inflammation. At the root of everything, we're looking for inflammation, because an injured joint is an inflamed joint.
Okay.
So if we can find where the inflammation is, we can find where the injured joint is, which ultimately helps us get people well on a quicker timetable. With that, I also take full spine digital x-rays. So I take x-rays of the spine from the base of the skull all the way to the bottom of the pelvis, because the spine it's a unit. It's a functional unit.
Right.
People think, oh, my pain is in my low back. It has to be a low back problem. And for the majority of cases, it probably is, but it doesn't have to be.
Right.
So it could be a mid-back problem. It could be a neck problem. It could be a knee problem, So we take the x-rays to make sure that I'm being specific with where I want to treat. And then we also use instrumentation. So I use what's called a nervoscope. It's a device that measures heat along the spine, along the skin of the spine. And heat is one of it's called the cardinal signs of inflammation. So anything that's inflamed produces heat.
Right.
And so by kind of narrowing in where these hot spots are in the spine, it further solidifies where there's inflammation. So you put all this together, all this soup together of the instrumentation. I look at the x-ray, I see what the patient actually is feeling, I see how they're responding, and I see where the restrictions and the fixations are in the spine. And then if all those things agree, it's pretty well and good that needs an adjustment.
Then you adjust that.
Yeah.
And what kind of techniques? Are there different adjustment techniques?
There are.
Manual or, well, I don't know what you call any of them.
Yeah, you got it right.
Okay.
Yeah, I'm actually surprised. A lot of people don't know that. But
Okay.
Yeah, so there's Gonstead chiropractors adjust primarily using their hands.
Okay.
And what separates us from mainstream chiropractic is that a lot of chiropractors, when they adjust, they're doing a lot of rotation in their adjustments.
Okay.
So they're kind of twisting the spine in this type of manner.
Yep.
With Gonstead, our goal is to adjust straight forward. So all of the adjustment it's perceived by the patient to be a very deep adjustment.
Okay.
Because it's going straight forward.
Okay.
But it's very safe. And it's very effective at
And you're going
moving
right
the bone.
at that bone. That's
Right
out
at
of
that
place.
bone, yep.
Okay.
So Dr. Sweary told me one time, I can't ever get it out of my head, but he said, if you're off a centimeter, you might as well be off a mile.
Okay.
Because if the L4S5 or L4S1 disc is injured, and I'm adjusting the L4 L5 disc, I'm not doing my job.
Right.
Right. So that's my whole approach, is to find the problem and address it.
Right. Thus precision. That makes sense.
Yeah.
Well, tell people how they can find you and contact you and all that kind of stuff.
Yeah, so the office, like I said, is directly next to East Wind Buffet, which is
Right.
the Asian buffet here in town, across the street from Aldi, south of Lowe's. And you can call me or text me at 507-413-0962. That's my
Okay.
business number, so 507-413-0962. And then you're also welcome to email me. It's info@PCS. Those are the letters for
Right.
Precision Chiropractic Service. info@PCSchiro.com. And then people are also welcome to look at my website.
Sure.
So it's just www.pcschiro.com.
Okay, so they can learn, look at
Yeah.
the website, learn a little more about you.
And there's a lot of famous YouTubers who do Gonstead actually. So
Yeah.
if people are privy to watching YouTube videos, Dr. Rahim
Okay.
in Los Angeles is very famous
Okay.
YouTuber. He practices Gonstead techniques. So what I do is very similar to
So
what
if
he
you
does.
go watch one of his
Yeah,
YouTubes. Then
yeah.
you-
And he's got a great personality, so
Okay.
he's fun to watch. And Dr. Ian in Australia,
Okay.
Rossborough, he practices Gonstead as well, and he has a famous video. A lot of people who watch chiropractic YouTube videos probably recognize it, but it's like a 14, 15-year-old young man from America who flies in over there, and he's super stooped over after picking up a stump out of the ground. Like he literally looks like
Okay.
this, And over a series of adjustments, he's able to stand up, and his dad
Cool.
starts crying, and all the emotional
Cool.
stuff. But so he practiced Gonstead, and that's how
Great.
that young man got well. So.
Great. Well, thank you so much for joining us. It was great to talk to you.
Yeah, it's fun to chat with you, and I appreciate the time.